If you have to go to an emergency room, get ready to wait for more than 5 hours.
Yeah, that is the average wait in California right now. And health experts say you can blame Obamacare and covered California for that long wait.
KMPH Fox 26 News reporter Eric Rosales investigates Obamacare and the effect on emergency rooms, and he uncovers that some doctors say it is only going to get worse. We've experienced this. We were just talking about this commercial break, seeing doctors' offices that say they don't cover Obamacare, cover California.
Exactly, and heading to emergency rooms, it will only get worse. Monty and Ashley, emergency rooms are seeing more patients than ever, and that's directly related to Obamacare. Some people are getting health insurance for the first time. Others are getting it after not having it for a long time. And since the number of family doctors who take Obamacare is not what the government said it would be, a lot of people are getting their health care from a place you're supposed to go in the event of an emergency.
So no, the Affordable Care Act hasn't completely fixed our long broken health care system. But this law has made our health care system a lot better.
Really? One of the promised benefits of the Affordable Care Act was to reduce the pressure on emergency rooms by expanding Medicaid and giving the poor better access to primary care.
Millions of Americans finally had the same chance to buy quality, affordable health care and the peace of mind that comes with it as everybody else.
But instead, a survey by the American College of Emergency Physicians suggests something else, that President Obama's health care reform actually has had a destructive effect on the nation's emergency rooms.
Almost half of emergency physicians polled had already seen a rise in their emergency department visits since January 1, when expanded coverage under the Affordable Care Act took place.
And more ER visits mean more crowded waiting rooms.
Definitely we've seen an increase in just kind of primary care stuff. I feel like I do a lot of primary care rather than emergency care.
Locally, officials at St. Agnes Medical Center in Fresno say that they've seen a sharp rise in emergency room visits since January. Community Regional Medical Center in downtown Fresno says it's getting 300 to 400 patients a day in its ER. Defenders of Obamacare, like House Minority Leader Nancy Pelosi, suggest it's, quote, a work in progress. Others blame a long-standing shortage of primary care doctors and the fact that some doctors won't accept Medicaid.
Even if we loved it and wanted to do it, we'd go bankrupt doing it.
Clovis Dr. Robert Subers says his office can no longer accept Obamacare patients. He says the numbers don't lie. Dr. Subers says he charges roughly $80 a visit. With his expenses for support staff and equipment, he says he turns a small profit. However, Blue Cross Obamacare only pays a doctor $47 per patient visit, which means that he'd be paying the insurance company roughly $1 of his own money to see a patient.
If it was supposed to increase access to care, Obamacare, and if it was supposed to bring down health care costs, I'm trying to find out where it's done either.
So what is the answer? 9 out of 10 of the emergency room doctors surveyed believe that emergency room visits will only increase by patients over the next 3 to 5 years. A majority of those doctors say that they're concerned that their emergency rooms are inadequately prepared to handle the increase in patients. And make no mistake, they are coming, and it will change everything.
Now, effectively, since more people have insurance, we're going to be the porch of the medical neighborhood. We're going to have to sort of rebrand ourselves as not just being for emergencies anymore, but rather being acute care, diagnostic, and evaluation and treatment centers.
I'd just like to reiterate what Dr. Subers said. He says in the past 40 years he's been involved in medicine. He says that these government mandates or insurance changes have all been done in the name of bringing down costs. However, he's yet to see that happen. Instead, Dr. Subers says the direction that he sees medicine heading is toward socialist medicine, where the government will step in and possibly mandate a doctor that he must see these patients in order to be able to practice medicine. And Monty and Ashley, if that is done, that could have a disastrous effect because a lot of people are going to go into medicine and practice medicine.
Right.
Or maybe not as a result of that.
Exactly.
Yeah.
Exactly.
And you were mentioning that he is expecting things to continue to get worse.
Well, he says it's going to get a point where the government is going to have to step in because this is not the answer. This is not working. This is causing. You can't blame doctors because we're in a capitalist state right now. I mean, where doctors they work hard. They go to school. They pay that money in order to be able to get paid. But when they don't get paid and they have to pay money out of their own pocket in order to see an Obamacare patient, you can't blame them.
Sure.
And we can both personally vouch that we've seen doctors put up notices that they won't accept Obamacare or covered California patients.
And they expect that we're going to see a lot more doctors do this in the near future.
All right, Eric.
Be interesting to see what happens.